So I'll tell you how my weeks look right now. On Monday morning, I go into clinic in our pediatric clinic, and I would look through our list of patients that are coming in today. I review their medication list to see if I notice things that look abnormal. If it has only come through experience, but if I see a 2-year-old that weighs 8 kilograms, which is about 20 pounds, I know what medications and doses look appropriate versus those that seem abnormal. I can identify potential interactions or duplication of therapy on those med lists before I ever meet the patient. So I can create a list of priority patients for me to see in that day. And we see 70 patients a day in my clinic. I can't be a part of all of those. So it does require some triage on my part to pick out the ones I think I can have the biggest impact for. At any time, I can also receive consults from providers that have specific questions, but I like to be in the room with the patients and the caregivers and work with them as much as I can. Monday afternoon, I teach in our pediatric elective, pediatric pharmacotherapy for P3 students in the fall. And so that's a 2-hour class that I'm in every Monday afternoon for this semester. I help coordinate. I'm our only clinical pharmacy member in our department that works with peds. So I coordinate that whole elective, and I identify preceptors and pharmacists from Children's Hospital that can come over and teach specific topics like neonatal ICU or pediatric oncology or congenital heart disease, things that are pediatric specific that I want to provide during the course of pharmacy school for people that are interested, but they're not part of the core curriculum. Tuesdays, I'm in clinic the full day. Wednesdays, I'm 20% research-based. So I'm involved in a large study that's funded through the AHRQ, which is a branch of the NIH. And we're doing a 5-year study to see if meeting with a pharmacist before your annual visit as a child, your routine care, if meeting with me before the visit to specifically focus on these long medication lists, come up with ways to optimize medications, maybe remove medications if they're no longer necessary. We call it deprescribing. This study is going to identify over the course of 5 years if that type of visit is helpful for clinical outcomes like symptom control, hospitalization rate, reliance on ER and urgent care visits. We're hoping that it does show that, and then we'll use that to try to justify for insurance companies that they should be paying for having this annual visit with a pediatric pharmacist. Thursdays, I cover clinic. Fridays, I cover clinic, and I have other teaching responsibilities that are kind of pop-up things. Like I teach in the P2 pharmacokinetics course, and we learn how kidney and liver function changes for a 22-week-old premature baby all the way through early adulthood. So I have 3 lectures in that topic later this year. I teach things like how to manage ear infections and things that are specific to pediatrics that are a part of the required classes. I also have, today was the last day of her rotation, 4th-year students that come join me, and I teach them about how to manage pediatrics in the clinic setting as a part of their 6-week rotations. I just came to this meeting from a student organization meeting where I'm an advisor for CU Pediatrics, which is right now we have 35 student members who are interested in some way in pediatrics and joined our organization. So I get to work in all kinds of areas that are not always patient focused. Most pediatric pharmacists are on the inpatient side of the hospital setting. So they usually come to work first thing in the morning. They work up the patients who are admitted to their team that day. Then they join the multidisciplinary team for rounds, and they go around from bedside to bedside and see those 10 to 20 patients on their service. They're engaged with everyone involved in the team, the medical providers, the nurses, the respiratory therapists, the dietitians, making suggestions for how to manage whatever brought the patient to the hospital in the best way. And then in the afternoon, after those patient care rounds are over, they're usually teaching students or residents. They're joining committee meetings that may be focused on hospital policies. They're helping to discharge patients safely or reviewing medication changes that are occurring as they go from the hospital setting to the home setting. But they have a more standard, like their day is based around patient care rounds for the most part.
Thank you so much for sharing.
Yeah.
My question is about the residency part. So based on like what you want to specialize in after your fourth year, does that determine like how long your residency will be? And then my second question to that, can you kind of go through exactly like, or more or less kind of like what your first and second year residency, like what you kind of went through and like how different they were, or if they were kind of similar?
Yeah, definitely. You are correct that what you want to do will dictate whether you need residency training, what that residency training looks like, how long it is. For example, you could go into what we call typically an operational pharmacist position in a hospital setting without a residency training, where you're involved in preparing IV products, verifying orders, all of the operational aspects, but not necessarily. You may make recommendations, but you're not necessarily standing there with the physician when they're deciding what plan to make. That doesn't require residency training in most hospitals. If you wanted to do internal medicine, which is a broad adult hospital service, you might do just a single PGY1 residency at an adult hospital where you spend 12 months getting additional clinical experience from preceptors who have been doing it a while, learning about specific disease states and disease state management. Or if you knew you wanted to do cardiac ICU as your job, then you might do a broad adult PGY1 and a second PGY2 in cardiology, or a second PGY2 in critical care, where that second 12 months is more focused in a subspecialty. Those are paid. That you typically make around half of what a pharmacist would make if they were not in residency training. But it's similar to your API year in that most hospitals have 1 month rotations that rotate through various areas. So my PGY1, I started with internal medicine, general pediatrics, adult pulmonary ICU, adult emergency department, pediatric ICU, had a pain clinic that I worked on throughout the year, a couple times a month. I had an academia rotation where I worked with faculty members at the school that I was, the site that I was at. I had a neurology rotation and a cardiology rotation, and all of those are 1 month experiences with experts in that area. Then my second year, which was peds focused, I had already completed general pediatrics and pediatric ICU rotations during my first year. So I was able to do a more advanced pediatric ICU rotation in my second year, in which I was actually the preceptor for one of our students. I was able to do an extra neonatal ICU rotation, a pediatric emergency department rotation, pediatric cardiology ICU rotation, so a couple general pediatrics rotations, one that was specifically focused on nutrition, where we focused on IV nutrition that patients had to receive when they were unable to take things by mouth during their hospitalization. So they're all 1 month unique experiences, and all of those rotation areas usually have a pharmacist that works there full time. So you're working side by side with the pharmacist that's doing that for their career.
Thank you.
And just to be clear for everyone, this is pediatrics, so residency is a big part of it, but residency training is not required. You can graduate from pharmacy school and go into a wide range of careers without that additional training, which is at a lower pay. But that additional training, like when you're working with patients that actively have the disease states in front of you, instead of learning about them in a PowerPoint classroom setting, when you're learning about it from people who do it every day, that's where I felt like I personally made the biggest leaps in my abilities. I felt like I had a good base coming out of pharmacy school, but the residency process is very valuable if you want to be in a specific patient care area, and you decide that before you graduate.
I have a
You
question
also-
for you. I'm
Yeah,
sorry, I have lots of questions.
go ahead.
Um, but what would you say are the challenges that once you graduate, pharmacy school, what are the challenges to get into like specific areas? Like, for example, pediatrics, if we would be interested like in being like a psychiatric
Psychiatry.
pharmacist,
Yeah.
what are the challenges, or at what point would you say we would have to decide, okay, this is the field we want to go to, and once graduation comes, what are the challenges to get into that field?
Great question. I would first preface it by saying in pharmacy, I know of many people who have completely transitioned direction of their career well beyond graduation. So you have your doctor of pharmacy, you're qualified to do anything at any time. Even this residency training, you don't have to do right after school. You can go work for a few years in one setting and then decide to go back and get residency training in another setting. I think if you want to do residency training right out of school, I didn't decide that finally until I was in my fourth year. So developing a well-rounded group of experiences to make yourself competitive in a general sense will be important during pharmacy school, but it doesn't have to be psychiatry focused for 4 years. You could maybe join the psychiatry student organization and be a general member and potentially run for a leadership position in that. But you could be a member of multiple different student organizations so that people know that you have interest in multiple areas, but one of them was this area that you ultimately end up deciding. So the programs for residency, they want to see that you were involved as a student in either leadership or at least as a member of various focused organizations. It's always nice if you can get at least one research experience of some kind, whether that's a clinical research project where you might retrospectively look through patient charts for some specific goal with a faculty member or a preceptor at some point during school. We have a whole department of pharmaceutical sciences that does more traditional benchtop research, medicinal chemistry, drug development, stuff like that, where you could work in either a paid position during pharmacy school with one of our faculty members, or you could do that as an experience, like an advanced practice experience that takes up 6 weeks of your fourth year, or you could potentially just do it in an unpaid role and maybe have less stress about like keeping a schedule. So getting some type of research experience helps because that's a requirement of residency training. So they like to make sure that students have had some exposure. Doing well in your coursework obviously is important. There's some programs that have minimum GPA thresholds, like they might say you need to have a 3.0 in pharmacy school in order to make it into the interview stage for our residency program. Picking rotations that are challenging, I think, goes a long way. So you have the option to kind of build your fourth year and your summer experiences as you like. But if you can identify ones you think will be more challenging to you, it'll make for a harder experience, maybe more time that you have to spend outside of the rotation to feel like you're prepared and understand things. But people really appreciate that you challenge yourself in that year, because that'll make for a strong resident who's willing to challenge themselves as well. So I think you'll learn a lot about what a pharmacy CV or resume looks like, and just trying to find some things that make you a better candidate in either a wide range of areas, or if you know you want to do psychiatry and you make everything focus on psychiatry, you might shoehorn yourself in a little bit, but then that's another approach to it if you want to make your experiences tailored to what you think you want to get into instead of quite so broad.
Thank you.
You're welcome.
And being mindful of time, we have time for one more quick question.
Before
Heidi.
Heidi asks,
Oh, yeah, go ahead.
I got a couple of questions sent to me directly. So I think we can squeeze in all of them. One of the questions is the process of residency in pharmacy similar to that of med school, where you have to match to a residency at a specific location? That is the same. So we have a match day. Every pharmacy student or graduate receives their residency match on the same day each year. So the interview process at different programs kind of lines up, and you submit your list of the 8 hospitals you interviewed with that in the ranking you like, and they submit their list of the 30 candidates they interviewed in the order they like. And it does a good job. It favors the students to match programs to students with combined interest. But you will end up at one specific site, and that site may have opportunities. Like on this campus, our psychiatry focused peds residents might do a psychiatry rotation at the Veterans Affairs Hospital, which is very much not peds, but it is helpful for a psychiatry pharmacist. And the follow-up question was, are there any developments in the field that we've had to adapt to since I became a pharmacist? And that is very much the case. So even if we think at the most basic level, there's usually around 30 new drug approvals each year through the FDA. Those are things that I never could have learned about in pharmacy school because they didn't exist. So that's about 300 new drugs that have reached the market since I graduated from school. Keeping up with those and learning how they might be used in pediatrics is one component. But I also subscribe to a lot of journals and frequently look for things in my practice area so that I can keep up with studies that are coming out that may change the way I practice. And I think that's important to be successful in patient care, no matter where you end up. And now I'll give Heidi the chance to ask her question.
Okay, thank you. Okay, so I'm more of like a returning student. I've already had a career before, and I'm changing careers, and I want to go into be a pharmacist and to apply. What do you recommend for somebody who doesn't have a background in pharmacy? Do you think it'd be good to kind of like try to get pharmacy tech, just to kind of get a understanding, see like, okay, this is the right field for me, get the information to be successful in pharmacy school, or I'll leave that to you.
Yeah. That's a great question. I think pharmacy exposure is one way to do it. And the community pharmacies are definitely the most accessible. Like if you did take a technician job, that gives you valuable experiences in pharmacy. But just to be aware, that is one component of pharmacy as a field. And I don't know that everyone is happy in a community pharmacy facing patients and fielding the types of things that those pharmacists do. So it wouldn't be a bad thing to do, but it might not be necessary. I think if you reach out to our Office of Student Services, the people that you can access and know may be able to provide a contact for this. But if you're local to Colorado, reach out to our preceptor group and can try to set up some shadowing experiences for you in different areas. I think just being able to say, I've researched pharmacy as a profession in that I know that there's pharmacists in these different types of sites and they're interesting to me, and I've had some exposure. I've shadowed this pediatric pharmacist or this community pharmacist or this adult hospital pharmacist, even if it's just for a day. We want to see that you know what the pharmacy profession means to us as faculty, and like it's a field we love. So we want to just make sure that you, as you're committing to come to our school, are passionate about patient care and improving outcomes. If you can do that, I don't think you have to have job experiences that are focused in pharmacy. We have a lot of students that don't have pharmacy backgrounds, but we want you to be confident when you enroll for 4 years in our school, that this is something that you will enjoy and it'll be a good fit for both you and us. So any experiences you can get to gain additional insight into various aspects of pharmacy, I think would be nice to have for you to be able to speak to during interviews and to be able to throw on your resume at the time of applying. We already know you have a good science background just based on prerequisites that would be required to come to our program.
Thank you.
Great. Thank you. Thank you, Dr. Orth. Thank you everyone for coming to attend. Very valuable. So everyone look for an email from me tomorrow. So regarding the app fee waiver, but then you'll also have my email address. So if you have any follow-up questions to this, feel free to just let me know. And we hope to see you apply and be a student here in the future. So yeah, hopefully this was helpful. Thank you again, Dr. Orth, and thank you again, everyone, for coming.
Thank you,
Yeah.
everyone.
Thanks for joining.
Thank you.
Okay, bye, everybody.